Thanks for joining. Those of you who have already signed on, we'll get started in about a minute or a minute and a half. All right, thanks everyone for joining. We'll go ahead and get started. I'm sure we'll have others join us in the next couple of minutes as they're logging on, but just wanted to mention a couple of quick housekeeping notes. Number one, all participants are going to be muted in listen-only mode for this. We will have the ability to unmute during Q&A if you would like to ask your question that way, but we also have a Q&A box that should be in your Zoom menu on the bottom of your screen or whatever device you're joining from. You can submit questions today throughout the presentation, but we'll do a Q&A session for the remaining 15 minutes as we close out. But with that, I want to turn it over and thank everybody for joining again to Dr. Samantha Duke, Chair of VCCA.
Hello, everyone. Thank you so much for joining us today for VCCA's Health in Our Changing Climate webinar. We are delighted to have Dr. Todd Sack with us today. You know, for a pediatrician like myself in a busy practice who is very concerned about environmental health and climate change, I can say that sometimes making changes in an individual practice can be one of the hardest things to do. And I'll say that while there seems to be a lot of attention and work on hospitals and health systems and a lot to be done, often there's not as much direction for smaller practices. So I greatly appreciate the work that Dr. Sack has done over the years, and really My Green Doctor has become the leader in advising small practices on how to become greener. So thank you, Dr. Sack, for joining us today. And I also want to invite Dr. Sue Weinstein to say a few words.
Thank you so much. I'll only make it a few words because I could talk about Dr. Sack for 30 minutes, which would take most of our time. We've known each other for about 13 years, and ever since I've known Dr. Sack, he's been involved in the environment and health. And back while he served on an environmental community in the city of Jacksonville, he's been advocating and educating for such a long time. I'll let him talk about My Green Doctor. So I'll just say that he's currently on the board of directors of the Physicians for Social Responsibility, which is a key group we all know about. He chaired that for 10 years, the Environment and Health section of the Florida Medical Association. And he also has chaired the Community's Environmental Protection Board, which I believe he started in 1998. So he's been way ahead of the curve in terms of thinking about climate and health for such a long time. He served on the Florida Energy Commission when he chaired the Climate Change Advisory Group, and he's authored 20 environmental and climate policies adopted by the AMA. He's a graduate of Yale. He trained at University of California, San Francisco, and we met while he was practicing gastroenterology in Jacksonville, Florida, and he was volunteering hours of time with an organization helping to bring specialty care to the uninsured. So it's my pleasure to introduce you to Dr. Todd Sack.
Well, thank you very much, Sue. Let me get my slides going and then, great. All right, I hope you can hear me. John or Sue, do you all hear me well?
Coming through
All
well.
good.
Great, thank you. Well, I want to thank John Bagwell and Sue Weinstein-Nussbaum and Dr. Hadut for inviting me and for that very generous introduction. Please call me Todd. I'm just delighted to be here to talk about adding climate change to your healthcare practice. It's going to be kind of a nuts and bolts, how to do it kind of talk. I've sent all my slides to Dr. Bagwell, and I hope they put them on your on the VCCA website. So go ahead and use my slides as reference or put your own talks together. Let's get the word out. I really admire what VCC has done. Your website's really spectacular, and the seminar series is so impressive. So great work. Thank you for doing this. My name is Todd Sack. I use the pronouns he, him. I'm speaking as Executive Director of the Migraine Doctor Foundation, a 501c3. And let's see if my slides will advance. Yay. Okay. As Sue said, I'm a gastroenterologist in Jacksonville, trained at UCSF. I spent a lot of time giving community talks and CME lectures on climate change and health. And if anyone would like PowerPoint slides, I have many of them available at migrainedoctor.org for you to use and make your own. And I help health professional societies to adopt wise climate change policies. I think our professional societies are a very potent route for us to be more effective, rather than just speaking as individuals, to speak for our peers. And to do that, we have to begin by having our societies adopt sound and important policies on environmental sustainability and climate change. If you'd like any of those policies, reach out to me and I'll send you lots of examples. But I've highlighted that I'm also on the steering committee of the Florida Clinicians for Climate Action, and I'm executive director of the Migraine Doctor Foundation. I have no financial disclosures. Neither our foundation board or our volunteer editors or myself receive any money from Migraine Doctor. So I'm going to talk about 4 things today: why climate change and health matter, the importance of outpatient healthcare practices, resources available to you for greening your practice. Then I'm going to spend about a quarter to half the talk on Migraine Doctor itself, ending with getting you started today in your practice. So let's start with climate change and health. I want to say, though, that it's kind of daunting to speak to this audience about climate change and health, because many of you have heard lots of talks on this topic. Many of you are probably already speakers yourself. So I decided to pick sort of 3 points to kind of highlight current climate change science and maybe some fun ideas that you can use in your own talks and your own thinking about this. But I want to always refer to the human disasters of climate change. This is my town, Jacksonville, Florida, after Hurricane Irma in 2017, to this dreadful economic and emotional and health devastation brought to thousands of people in our community. This was only a level 1 hurricane, the lowest level hurricane on the scale 1 to 4, and the devastation was just awful. So always keep in mind the terrible human toll being faced in Florida and many other places, really everywhere around the world. You've all seen this slide showing the gradual temperature rise between the beginning of the industrial era and now. This is temperature rises, land-based temperatures at 4 different institutions on 3 continents, and showing that wherever you measure it, the climate is warming about 1.2 degrees Fahrenheit, 0.85 degrees centigrade so far. But I want to talk about 3 aspects of this. I want to begin with Professor Argenias, a Swedish scientist who lived 1859 to 1927, one of the most brilliant physicists and physical chemists of his day. He gained his PhD in 1884 at the University of Uppsala on electrolyte conductivity, and his PhD thesis included 56 new theories about physical chemistry. Interestingly, his thesis was almost rejected. He got a D in his thesis, though the principles he went on to assert have all been adopted as a standard of thought in chemistry, and he went on to win the 1903 Nobel Prize in Chemistry. The most important part of that dissertation was he's the person who figured out that when you dissolve a solid in liquid, say sodium chloride, salt in liquid, that it breaks into ions, and that the liquid becomes then a pool of ions, no longer intact molecules. And that's absolutely essential for understanding chemistry, chemical reactions in liquids, and of course, batteries. He went on to have major breakthroughs in immunochemistry. He actually invented the term immunochemistry, geology, astronomy, physical cosmology, how planets were formed, the current theories he's a big part of having created in astrophysics. He was a leader in the Nobel Committee from 1901 to 1927, and he's sort of remained as having been a kind of a domineering figure who would keep off the Nobel Prize people who were his competitors in science and accepting those who he liked. He was also a member of the Swedish Society for Racial Hygiene, something that we cannot admire him for, part of the eugenics movement. So he has kind of a mixed reputation, but clearly a brilliant scientist from his first discoveries. One of his discoveries was a paper in 1896 on the influence of carbonic acid in the air upon ground temperature, in which he predicted that humans burning fossil fuel would warm the climate. He would just, breakthrough information. And here's a newspaper article from 1902, Selma, Alabama newspaper. A Swedish professor, Sven Argenias, has evolved a new theory of the extinction of the human race. He holds that the combustion of coal by civilized man is gradually warming the atmosphere so that in the course of a few cycles, the earth will be baked. I mean, he predicted what we're all talking about now. And although his work is based upon some chemistry principles that others had invented, his analysis was absolutely prescient and correct. And it's about what we're talking about today. A second person I want to remind you of is Dr. Charles Keeling, more of a contemporary, who, when he was at Caltech, just getting out of chemistry grad school, he invented the first device for measuring carbon dioxide in the atmosphere. He did that in 1856. Then in 1858, he went off to Hawaii's Mauna Loa volcano to begin continuous monitoring of carbon dioxide in the atmosphere. And there are now direct recordings of carbon dioxide in Antarctica and 158 other sites around the planet. Now we're reaching 418 parts per million, a level last seen 15 million years ago in the middle Miocene. And on the right, you see the famous Keeling curve showing how carbon dioxide has risen. The data from prior to 1958 is obtained by other methodologies. His data is shown on the far right, the heavy black line showing how CO2 has so risen with Keeling's measurements. So Charles Keeling and the famous Keeling curve, really important. So what's the implication of this? This is a picture from University of Florida of what Florida looked like in the middle Miocene 18 million years ago, the last time we reached levels of CO2 like now. And you can see the sea levels were much higher than they are now. And that Florida was just a tiny wisp of a peninsula, that all the cities that we now think of as Florida would be underwater. And the great fear we have is that the current levels of CO2 already have baked into the atmosphere the outcomes that we're seeing here of dramatic sea level rise over the next 100 years. So really scary to put Keeling's data together with the historic geological record. The last exciting climate information I want to share with you is the concept of ice cores. This takes us to Vostok, Lake Vostok in Antarctica, where a team of international scientists led by Americans drill cores more than 2 miles into the ice core to collect samples of ice that were deposited as snow hundreds of thousands of years ago. And these cores are taken out by scientists and flown in refrigerated frozen airplane beds to the National Ice Core Laboratory in Denver, where many thousands of ice cores are stored, ice cores from Vostok and from the other 2 centers in Antarctica that are drilling. And they can take tiny slices of an ice core and actually collect the atmosphere deposited in those air bubbles from 100,000, 200,000, 300,000 years ago when that snow fell, and give very precise direct measurements of carbon dioxide and oxygen, look at the pollens and get accurate estimates of temperature. And this is the kind of record you get from that. This is the graph going back 300,000 years. Man appeared something like 200,000 years ago. And what you see that over these 300,000 years, there have been fluctuations in temperature and carbon dioxide. They follow each other very carefully, but nothing like what's happened in the last 50 years. You see a dramatic anomaly in carbon dioxide levels far beyond what has been there in the human experience. And of course, we fear that the temperature rises are going to follow inexorably as well. Okay, I'm going to leave that, but remind us of the human health toll of climate change. And I know you've seen this before, but I just want to remind you of what's occurring. The climate change is leading to rising temperatures, rising sea levels, and particularly these extreme weather events of extreme heat and rainstorms and hurricanes and tornadoes, flooding, and the droughts and the fires. And it's particularly the extreme weather events that we as clinicians need to be preparing our patients for, so that we can avoid some of these health impacts of heat-related deaths, asthma and heart attacks, which are all worse in a hotter climate because the heat converts air pollution to photochemical smog. Increased rates of cancer from the burning of fossil fuels, emotional illness, emerging infectious diseases, malnutrition and famine, which is already occurring, and of course, the terrible problem of war and climate-related refugees. So I'm going to leave that topic of why climate change and health matter, and let's talk about our own outpatient healthcare practices. Why are clinics and offices important? Well, the US healthcare industry as a whole is responsible for 5 to 10% of America's greenhouse gases and air pollutants. Our industry itself is very important, and that air pollution leads to over 400,000 years of lost life annually in the United States alone. Now, outpatient care's responsibility is 26% of the whole healthcare industry's air pollution and greenhouse gases. So what we do as outpatients really does matter in the big picture. And in fact, outpatient care may be as much as 2% of America's greenhouse gases. There are millions of healthcare offices worldwide. There are huge opportunities for our offices and we to save resources and save money. We can influence the choices made by our patients. That is, sure, we can green up our own offices, save some money ourselves, but we also have the ability to talk to the thousands of patients who come through our waiting rooms and offices every year to help them make wise choices. And I think physicians are uniquely available to reach those climate vulnerable communities that others are not able to reach. So that those climate vulnerable, often economically disadvantaged communities really can be reached by physicians in ways that others cannot. And of course, health professionals are role models. If you look at any survey of which professions are most trusted, and this is true in any culture, nurses, medical doctors, and pharmacists are always in the top 5 as the most trusted. So when we set an example for our patients, when we talk to them about these important topics of environmental sustainability and climate change, people really do listen, they really do pay attention. But what are the benefits to us, to our practices of going green? We can save money by lowering our overhead costs. We can decrease our use of energy, water, chemicals, and other resources. We improve our office teamwork and staff morale. I've been to lots and lots of meetings of sustainability in offices, and I see that everyone in the office really enjoys being part of this process, whether you're the physician leader or the clerk or the cleaning staff or the IT staff or a manager. People really feel proud of an office that's thinking about these topics. I think it leads to a better patient office experience, can improve the public relations profile of the practice, and improve patient trust, and maybe even extending to people being more compliant with the medical advice that we give to our patients. Creates a healthier office by decreasing indoor air pollution, encourages wise choices by patients and family. I think the bottom line is we have the opportunity to improve community health in this way as well. Now, as I think Sue and John may have said, there are many resources available for hospitals. Healthcare Without Harm, with its Practice Green Health program and Healthier Hospitals Initiative, has wonderful resources for our hospitals. And if your hospital isn't a member of Healthcare Without Harm, please speak to your hospital administrators, get them to sign up. The American Hospital Association also has its sustainability roadmap, which I really love. And they work on topics like eliminating solid waste incinerators, eliminating mercury devices, using energy wisely and adopting renewable energy, waste management, reuse of materials, recycling, dealing with packaging and plastics, greening the hospital supply chain, dealing with minimizing the use of climate warming anesthetic gases, the hydrofluorocarbons, transportation choices for employees, being climate advocates in Congress and in state houses, and promoting healthy food choices on the hospital tray, in the hospital cafeteria, and for patients at home. So I'm a big fan, particularly of Healthcare Without Harm. Be sure your hospital has a sustainability project, and get on the committee if you can. You'll really learn a lot. But the resources for practice managers and office professionals are more limited. I'm a big fan of the Royal College of General Practitioners Green Impact for Health program. It's a little complicated to use, but it's really interesting. There's a recently created program that nurses can use in their office practices called Nurses Drawdown. And it's kind of limited now, but I'm excited to see how that's going to develop in the years ahead. The American College of Physicians has a wonderful climate change toolkit. You do not need to be an ACP member to use it. It has brochures and pamphlets that you can download for the office. And finally, the My Green Doctor program that I'm going to talk a bit more about now. We're available at two websites, mygreendoctor.org in English and mygreendoctor.es for our Spanish preferred health professionals and patients. So what is My Green Doctor? This is a comprehensive, free environmental sustainability practice management program for healthcare offices. So we really help you manage your practice more effectively. It's evidence-based, written by health professionals, and has more than 450 pages of content. It's really the most comprehensive service of its type on the web for any profession, but most people don't need to read the 450 pages, as I'll talk to you about in a minute. It's suitable for any outpatient clinic, office, or outpatient facility, a diagnostic center, an acupuncture center, an outpatient imaging center, whatever. No study or science background is needed. We provide everything users need. There are more than 800 registered offices in 45 US states and 61 countries. And when used optimally, it can save as much as $1,500 per doctor per year forever with no overhead cost input needed. We have a number of organizations, now 21 organizations that participate in My Green Doctor, meaning that they agree to provide it to their members. My Green Doctor offers this service to these organizations for free and free to their members as well. Big organizations like the American Academy of Family Physicians with 120,000 members, or the American Academy of Dermatology with around 40,000 members, to very small groups like the Alameda Contra Costa Medical Association or Florida Clinicians for Climate Action. So this is a way that we communicate My Green Doctor and share the resource. The health professional societies give it to their members as a membership benefit that saves the members money, and we hope helps clean up their offices and helps them to influence their patients' decision-making. When individuals register, they get sent this Green Doctor Office Pledge Certificate for them to print out. It's available in any language, and we've given it out in about 14 different languages, including Thai and Portuguese and all sorts of Arabic, all sorts of languages. And we encourage people to print it out, get a simple, inexpensive frame to display it proudly in their waiting room and in their lunch break room as well for the staff. We have something called the Meeting by Meeting Guide, which encourages offices to add 5 minutes to each regular practice planning meeting. So if your office meets once a week or once a month to go over business issues, or maybe your office staff huddle once every morning, let My Green Doctor be 5 minutes of your meeting, maybe once a week or once a month. Each 5-minute session is fully scripted. It explains exactly what to say and do at each meeting. So there's really nothing for the manager of the office or the team leader or the physician leader to study. We really provide it all. We focus on very slow, steady improvements. We want this to be sustainable as a sustainability program. So we ask you to go slow and steady and gradually get there. We emphasize patient and staff education. We try to involve every member of the healthcare practice, and we provide green team notes for easy record keeping. So it's pretty straightforward. How about green teams? No, I'm not in favor of green teams, and I'll tell you why. When we started My Green Doctor 12 years ago, we encouraged practices to have a committee that meets once a month over pizza to talk about greening the office. And what I learned in the first 8 years of this is that every single green team fails. And it fails because it ends up being 3 or 4 people out of a big office, and then somebody can't come because they got tied up in clinic, or someone's on vacation, or the meeting gets canceled. And every green team I observed, many, many dozens of them, failed. That the way to do My Green Doctor and a sustainable sustainability program is to make sustainability and climate change an integral part of the practice and incorporate it in every practice management meeting so that everyone is brought on board and everyone respects and appreciates the importance of sustainability. So no to green teams, yes to a sustainable sustainability program. The solutions offered to My Green Doctor on lots of topics. We encourage offices to analyze their carbon footprint, to use energy wisely with Energy Star appliances and looking at the thermostat settings and other measures. We encourage safe use of chemicals. We teach about recycling and avoiding styrofoam and other products, healthy foods, healthy for the patients, healthy for the staff, and healthy for the environment. We have lots of teaching materials, posters and brochures on lots of different topics that people can put in the waiting room, and the pledge certificate that we encourage health professionals to print out and display proudly in their waiting rooms. We have our Your Healthy Home series of brochures, which I think are state of the art, the best there is for waiting rooms. And we've been trying to raise money to give these away to doctor office waiting rooms so you can share sensible ideas with your patients. We actually just got funded to study this. We're doing a study at Stanford Medical School and at Georgetown Med to actually assess patients' reactions to our brochures. So we should have some data to publish in the fall on this. And we have a program for gaining Green Doctor Office recognition. And you can read about the criteria for earning the certificate. The certificate is $250 every 3 years, or free if you're a member of one of our participating organizations. So one of the benefits of participating is when you earn the recognition certificate, you get it for free from My Green Doctor and from your participating organization. So I'm getting towards the last few minutes of the talk, and now I want to emphasize getting you started today. And because I want to find ways to motivate your practice to go green, adopt environmental sustainability, and save some money. So adding climate change to your healthcare practice, I've learned over the years, is not an easy sell. And we try to find ways to make it easy so that people can go ahead and do it. It begins by registering at My Green Doctor. I've given you today a discount code, MGD Welcome, which makes it free for you for 1 year. Or if you belong to one of our participating societies, you get a different discount code, which makes it free forever. We really think the way to begin, the second step, is to adopt sustainability as a core value of the practice, to have management on board, to make this just something that's important to your practice, as important as giving outstanding healthcare and HIPAA compliance and respect among your peers for each other and treating everyone fairly. Sustainability should become one of your core values. To use and to brag about it, to talk among each other and to put up your certificate in the waiting room so that this becomes something you do. It becomes part of the culture of your practice. And then to add 5 minutes of My Green Doctor at each practice meeting, whether you meet as a huddle, as a group, or meet once a week or once a month to discuss business matters, just add 5 minutes of My Green Doctor. And to make very small, steady improvements in your organization using the meeting by meeting guide. Some people say to me, Todd, we want to go ahead and get going. We want to move more quickly. I really discourage that, because when offices try to bite off more than they can chew, their green team efforts fail. So small, steady improvements, 5 minutes for each practice planning meeting. And over the months, you'll suddenly realize how much you've achieved. Provide patient brochures, posters, and other teaching tips in the waiting room. And then commit as part of adopting sustainability as a core value, commit to qualifying for the Green Doctor Office Certificate, something you can really aspire to do and can feel very proud of. And then you'll be continuing your regular meetings even after you earn the certificate, because it's going to expire in 3 years and you want to keep going so you can renew it. So I want to give you one success story, the Escambia County Health Department in the Panhandle of Florida, and you can read about this in our success story area on our website. This is 5 offices in the Florida Panhandle. They've been saving energy every month since they started using My Green Doctor. And the first year they saved 5% on their electricity. This was 120,000 kilowatt hours of electricity per year. They averted 85,000 metric tons of carbon dioxide per year through their energy savings. And the bottom line, they saved, and they've been saving about $14,000 every year. And they've used the money to do fun things. About 2 years ago, they were able to fund putting solar panels on the roof of one of their buildings. And here's their panels on the right. They did some very innovative things. One of the things they did is they were, and one of the 5 clinics, one of them is actually an HIV clinic, but they learned that you don't need hot water to wash your hands. You just need friction and soap and water. And so they turned off their hot water heater and saved a lot of money doing that. So people, this is part of the process of the whole practice meeting together, is people find really wonderful, innovative things that they can do in their practice. And it's also why I think the top-down approach of having a big institution impose rules on an office really are not effective. It's when everyone in the office participates in the meetings and brings ideas to the fore that really creative, interesting ideas that work in that office can emerge. And that's the fun part of this process. Okay, I'm second to my last slide. I want to get you started today. So I encourage everyone to register at My Green Doctor, use a discount code MGD Welcome. And then when you're next in your practice, talk to the leaders of the practice, your managers, about adopting sustainability as one of your core values, and to brag about it. And you do that by registering and putting up your pledge certificate in the waiting rooms. Add 5 minutes of My Green Doctor at each practice meeting. That's where you need the manager to get this onto the agenda. And then you make sure it stays on the agenda of each practice meeting. Make those small, steady improvements in your organization using our meeting by meeting guide. In I think week 5 of the meeting by meeting guide, you go to the topic of patient education, where you'll provide brochures or posters or handouts or other teaching tips. We have dozens and dozens of teaching ideas for the waiting room and for the exam room. And finally, part of adopting sustainability as a core value is to commit to qualifying to earning the Green Doctor Office Certificate. By the way, on our homepage, we have a video. It's not that sophisticated, but it helps. It's our 3-minute video. So it's going to take you 3 minutes to register and 3 minutes to watch the 3-minute video, and you'll be on your way with your own sustainability process for your practice. So that's it, adding climate change to your healthcare practice. I want to thank you for going green today. Remember that discount MGD Welcome, the discount code. And again, I want to thank John and Sue and Sam for inviting me today to talk with you. And I'm available for questions. I'm going to stop my screen sharing.
Excellent. Thank you so much, Dr. Sack. I'm going to share my screen again here so that we can just go through a couple of slides before we open it up for Q&A. I see that we already have one question, but feel free to submit additional questions through that Q&A box at the bottom of your screen. We always share a couple of advocacy opportunities in these presentations, and I just wanted to highlight that VCCA came out with a report on heat illness in Virginia a couple of months ago that we're very proud of, and hope that you will download that, read it, and share it with your networks. And of course, you can always support our ongoing programming by making a donation to VCCA as well. I also want to highlight that today's presentation is available for CME credit. You can scan that top QR code. Everybody will also be getting a follow-up email tomorrow with a link to CME credit instructions if you're interested in that. And with that, we will open it up for the Q&A portion here. Todd, can you see the question that has been submitted? You want to start with that one, and then we can see if
Yeah.
additional
Do you hear me?
ones come from there.
So the first question is, I belong to a huge hospital system. Your ideas are fine for a solo practice, but how do you suggest we grow a movement in a hospital system? Well, as I mentioned, the hospital for those big buildings has the resources of healthcare without harm and practice green health. So be sure your hospital is doing that. But healthcare without harm doesn't really help the retail office. And there's several ways to go about it. The most effective way is to explain that there's a resource available to your hospital administrators who own all these clinics. That's My Green Doctor, and just ask them to require their offices to embark on greening using My Green Doctor. This can be done tomorrow. They can all get started. At mygreendoctor.org, we actually have a institutional policy and procedure manual document that your institution can use. It actually sets up a system for how clinics would be asked to report to a central environmental sustainability office. I suspect you have, if you're in a big system, you have a sustainability officer for the hospital, but they won't get to their clinics for another decade unless you encourage them to just say, hey, require My Green Doctor in every clinic, ask every manager to once a quarter, give a report on how they're doing, and it'll get done. And each clinic will find its own way using My Green Doctor and its own ingenuity to go green. So that's my answer. Second question, which I'll answer. Thank you. As a gastroenterologist, most of the outpatient care is in the endoscopy unit. Do you know ways to mitigate greenhouse gas impact in this? Are there studies of GI care itself? So I'm a gastroenterologist as well, do all these procedures myself, and our practice owns several endoscopy centers. There are no guidelines yet in gastroenterology. There's been only one or two kind of opinion papers indicating that this is important, but wow, huge ways to save resources. Energy use is the number one. Most of our endoscopy centers leave the lights on and the computers on and the air conditioning ramped up on full speed 24/7. So lots of savings, but it's tough to do. I have not been successful to get our endoscopy centers to embrace this just because everybody's so busy. But energy saving to begin with, reusing products such as the patient gowns is really important. There's lots and lots of ways, and My Green Doctor provides the pathway to that.
Dr. Sack, I have a question. Have you had any examples, or have you worked with condominium boards? My practice owns our practice in a building that we don't own. So, for example, we're not directly in control of the cleaning, of the lighting, anything.
Yeah.
But we do have representation on the board. So I'm wondering if that has an approach that you are familiar with.
Yeah, I am familiar. It's a problem because many of us, we sign a lease and we share equally in the electrical costs of the whole building. And so you work with your staff to save energy and turn off computers and lights and buy the right equipment. You save energy, but you don't benefit in the full benefit because other units in the building don't have the same practices. The condominium association is a great way to do that. I mean, the tools of My Green Doctor can be used by any type of office, not just a medical office. So if you have accountants and other people in the building, hey, they should all see the benefit from this. It's about creating the right incentives. And you may have, and also as we renegotiate our leases, to be aware that the real opportunities for savings. People can save thousands of dollars in overhead costs by being attentive, but it's tough. I would do it in your own practice anyway, because it has its benefits for the health of the office if you're using electricity and chemicals and water wisely, and it may influence your patients' decisions too. But talk to your practice manager, your building managers, and see if they can try to green the whole building.
Thank you.
Yeah.
Any final questions from the group? All right, well, we will close out there a little bit early, but we thank everybody for joining and participating. We know that many of these webinars, due to clinical schedules, are viewed as recordings, so we will know that much of our audience will access it that way. But really appreciate your time, Dr. Sack, and a wonderful presentation, lots of opportunities for us to build and expand on this work. So thank you very much.
Thank you for all of you are doing. It's really wonderful.
Thank you, Dr. Sack.
All right.
Bye-bye.
Bye-bye.